Welcome to Bullet Point Nursing. My name is Dr. Goldstein. Let's get started. Today we're going through gastrointestinal issues, and we're doing this at the nursing fundamentals level. Let's begin with a brief anatomy and physiology review. The GI system or gastrointestinal system consists of everything from the mouth to the anus. This includes the esophagus, the stomach, the small and large intestine. It also includes some organs that relate to digestion, such as the liver, the gallbladder, and the pancreas. The liver's function is to filter toxins from the blood. It also has many other roles, including being a part of glucose storage, cholesterol production, blood clotting, and much more. The pancreas's function is to produce hormones such as insulin and enzymes such as amylase and lipase. The gallbladder's function is to store and secrete bile, which is used for digestion. Let's begin with our nursing assessment of the GI system. Bowel sounds are auscultated with a stethoscope, and they should be assessed in all four quadrants of the stomach. The stomach or abdomen are divided into four quadrants using the umbilicus as the center point. So drawing from the umbilicus or the belly button, a line top to bottom and side to side splits the abdomen into four quadrants. Abdominal sounds are classified as normal, hypoactive, hyperactive, or absent. You should assess a patient's bowel movements history for frequency, effort, consistency, flatulence, and color. So some questions you might ask is how often are you going versus how often do you go regularly? You might also ask how much effort are you having to put in? Are your stools, what is the consistency of them? So are they formed? Are they watery? Are they pure water? Are you having any flatulence or an abnormal amount for you as a patient? And finally, what is the color? Is it black? Is it red, such as bloody, or things like that? Fecal occult testing may sometimes be done to assess for blood in the stool that is not visible to the naked eye. Let's talk about one of the most common complications with the GI system, and that is constipation. Constipation is characterized as straining, hard stools, a sensation of incomplete emptying, and fewer than 3 bowel movements per week, again, if that is less than the patient's norm. Non-pharmacological interventions for the treatment of constipation include advising the patient to increase their fiber, increase their fluids, and increase their activity. We can also look at this list on the flip side. These are the risk factors for constipation: decrease in fiber, decrease in fluids, and inactivity or immobility. Squatting position may help a patient relieve their straining and their effort. You should advise patients not to ignore the urge to have a bowel movement. And finally, you should caution patients that many laxatives can cause dependency with long-term use. Pharmacological interventions for constipation are discussed in depth in the pharmacology section. Next, we have diarrhea. Diarrhea is characterized as loose, unformed, or watery stools with or without increased frequency. Diarrhea is usually caused by irritable bowel syndrome, inflammatory bowel disease, and infections such as C. diff, or lactose intolerance or celiac disease. Let's go through each of the 3 ancillary organs that we discussed previously. The first is the liver. Part of our assessment of the liver would include several labs. Liver enzymes that are used to assess how the liver is doing include the AST and the ALT. A normal AST and ALT are both approximately 10 to 40 units per liter. Elevation of these labs indicate problems with the liver. Bilirubin is another test that is used to assess for the liver. Diseases of the liver are NAFLD, which is non-alcoholic fatty liver disease, hepatitis, and cirrhosis. Hepatotoxicity is the term that is used for something that is harmful to the liver, and you will often see this in pharmacology. Moving on to the pancreas, we have 2 labs that we use to assess the pancreas, and those are amylase and lipase. A normal amylase is 21 to 100, and a normal lipase is 7 to 60. Elevation of these enzymes are a sign of pancreatitis or inflammation of the pancreas. Diseases of the pancreas include diabetes and pancreatitis. Next, we have the gallbladder, and diseases of the gallbladder include cholecystitis and gallstones. The gallbladder does not have any specific nursing assessment or laboratory assessments. Finally, just to wrap up, we're going to go through very briefly a few GI diseases that you may be aware of, and we'll discuss these much more in depth when we go through GI at the med-surg level. GERD, or gastroesophageal reflux disease, commonly referred to as heartburn. Peptic ulcer disease is an ulceration in the lining of the stomach or the duodenum, depending whether it's a gastric ulcer or a duodenal ulcer. Obstructions, such as a small or large bowel obstruction. And one thing that is not an obstruction is actually fecal impaction. While this is technically obstructive, it is not classified as a bowel obstruction. Fecal impaction is related to when the patient simply has stool that is stuck in the bowels. Finally, IBD, or inflammatory bowel disease, is a classification of diseases that includes Crohn's disease and ulcerative colitis. You may be taking care of patients that have a colostomy, and this will be covered in depth in lab classes where you go through how to deal with a colostomy bag. However, just to understand, a colostomy is an opening in the abdomen. That is where the contents of the colon now come out of instead of the anus. Thank you for watching. Here are the references. Have a great day.